The Spatz implantation procedure begins with balloon preparation. Start by pulling the green tabs to remove the bands. Push the valve hold completely into the white catheter, all the way without twisting it, as shown. This is very important. Connect the extension tube to the valve. Be sure to turn it tightly. After standard endoscopy, dry the scope tip thoroughly. Place the insertion facilitator on the end of the scope. Without unrolling it, use thumb and index finger on each side and pull it down the shaft until the distal edge is at the scope tip. Roll it back to cover its proximal hole. Place the balloon on the left side of the scope. Roll it over the balloon. With fingers on each hole, pull the proximal hole and then the distal hole over the scope. The balloon is ready. Insert the lubricated balloon and scope. When the valve reaches the mouth, the balloon bends to turn down into the esophagus. You may feel slightly more pressure. Don't force it, but use momentum back and forth to help it through. Retroflex to confirm presence of the balloon in the stomach. Straighten the scope and maintain the tip in the antrum. Ready now for inflation. Attach the three-way stopcock to the saline bag and the syringe. Inflate the balloon while the assistant holds the endoscope at the mouth during inflation. Once inflation is concluded, withdraw the scope while leaving the extension tube in place. Pull the extension tube. You will hear and feel the valve hold pop out of the white catheter. Pull until the valve exits the mouth. Secure the valve. Disconnect the extension tube. Connect the cap. The valve and cap are wet and slippery. Use a paper towel to assure tight cap closure. Lower the valve into the back of the throat. It will pull itself back to its position. Reinsert the endoscope to gently push the cap and white catheter below the gastroesophageal junction. The endoscope is removed. The catheter can face proximally or distally. As an alternative method, the insertion facilitator is placed on the balloon only and attached to the endoscope externally with a snare. Slowly unroll the insertion facilitator until both holes are seen. Roll it over the balloon with the balloon tip at the level of the proximal hole. Place a snare along the outside of the endoscope and grasp the endoscope and insertion facilitator distal to the proximal hole and not on the balloon. The balloon is now ready for insertion. Insert the lubricated endoscope with balloon. Once the endoscope reaches the distal antrum, open the snare, release the balloon, and pull the scope with snare proximally to the area of the valve. Ready now for inflation. After inflation, the insertion facilitator is removed by the endoscopist.